Good afternoon, good night, whenever you're watching this video. So today I'm talking to a doctor about mental related issues. So the topic for this video is how do I know I'm suffering from mental health related issues? How do I know all of those categories that are inside mental health, but mainly how do I know I'm suffering from mental health at the beginning of it? So that's the question. How do I know? At least, yes, how do I know that? It's not, it's now at this point, it's not normal. I need to see someone. How do I, how do I know that? Or how do I know that I'm not overreacting?
I think it can be difficult, and I think with mental health, you don't really get a black and white. Everything is kind of on a spectrum, and there's no blood test that you're going to do and be like, cool, you got depression, you don't. And it really comes, or for me, or for my training, it really comes down to how has your functioning been affected. Like if you're in school, are you coping with your schoolwork? Are you still doing your extramural activities? If you're working, are you functioning well at work? Are you able to have good relationships with people? But as soon as there is a decrease in function from a certain level, then we start thinking maybe we can do something to help. And there's nothing to say that there's something wrong with you or with me. Like I said, like I've struggled with anxiety recently, and initially you think I've got a problem. But I think if we look at it more like it's not me, it's just something that I have at the moment. Like some people have high blood pressure, some people have high sugar. It doesn't define them. It is something that they may have, and we can help treat it. And mental illness like anxiety, depression, or psychosis doesn't define who you are. It really is something that you may have at the time, and it's so difficult because it's really affecting your brain, and that is the part where in the brain obviously is, I almost call it, it's like your passport to life. Really, your brain is who you are, and as soon as something affects your brain, that is why it's such a difficult thing to treat. Yes. So really, we're talking about things that really change the way you interact with people and work and school. And if your mood is interfering to such a place that it's hard to do schoolwork or work, then maybe we can get some sort of help.
So, can these mental health related sicknesses come about without you experiencing any significant thing at the moment? Like, for example, some people get depressed after a relationship or get down after a relationship. Can it like be something that occurs to you randomly, or is it something that is always backed by a certain event?
It's a good question, and I think it's challenging in mental health is that there is no one cause generally for things, unlike a virus causes HIV. And mental illness is generally so many factors, and there's generally always a genetic factor involved, and there can be other environmental factors that work with that genetic factor that contributes to struggling with mood or anxiety, and in such a certain event may precipitate it or may make it worse, but that's not the only factor causing it. And especially in South Africa, with so much trauma going along, and with people, trauma is just your normal life. Yes. And trauma has a massive effect on your mental health, and repeated traumas are obviously going to affect you. And so sometimes it's not, one thing doesn't happen and suddenly you have it. Things often happen over time, and generally things that will happen over time.
So for anyone who's feeling or is suspecting that they may have issues, what could advice could you give to them?
I think the best advice is to talk about it. I think people have a stigma towards mental health, and the more we talk about it, the more we realize that It's not who we are, it is something that we have, and we can get help and we can live with it as it is, or we can get better, or it doesn't define us. If we talk about it to our friends, make it more normal. It's normal to have high blood pressure, to have high sugar. Why can't we talk about depression or anxiety in the same way? And I think that is a huge step. If we start talking about it and it becomes more of a normal life, I think we can go a long way to
people will understand it more. Then what if for someone that says, I'm trying to talk to my family about it, but they're neglecting it. I try to show them that I have a problem. I try to talk to them. Most of them are neglecting it. For that person, what can I do? Maybe is there any place that they could go? Maybe contact anyone for those issues.
There are numerous places, and I think the best place might be to start at your local clinic. And so you're seeing nurses or junior doctors there, and you can go further in the system. But I think it's difficult when your family don't understand your situation and often in denial of what's happening and perhaps will ignore the problem. And I think it's important just to talk to your friends, to go to a clinic, just chat to a nurse. You don't have to commit to anything, just have a conversation about it. So nurses are trained in mental health, doctors are trained in mental health. And also I think it's important in this country to talk to your religious leaders as well, to traditional healers. I think we all need to work together, and we need to have the same language and talk about it. And I just think I also think it can be quite hard to access help for mental illness. It's not always widely available, and I think that's where I think we need to involve religious leaders, involve communities more, and involve our traditional healers, and clinics need to be involved. And I think that's probably the best way to start.
No, thank you, Doctor. Thank you. Very insightful, very insightful. So now you know if you are not alone. You are not alone in the problem you have. It's a common problem in this country. So just speak to someone. Things will get better, or you will get help.
Yeah, and I think we often wait till we're really struggling. Let's chat a bit earlier before that happens. And I think we can be scared to ask for help. So when I struggled with anxiety, I would deny everything to say that I didn't have anxiety.
Yes.
But that first step to say, I'm vulnerable, it can happen to anyone. It doesn't suddenly make you a weak person. Or suddenly doesn't change who you are. But just talk to someone, chat to someone about it. You're not, as you said, you're not alone. We can help each other. And I think in mental health, we need to help each other more than the hospitals. We need to help each other and be there for each other.
Yes. No, thank you. Thank you for watching. Stay tuned, like the channel so other people could see the video, and maybe someone will get help and we could prevent a really tragic event of people harming themselves. So, thank you.
Thanks.